to support cancer survivors and those that are on treatment in Kenya. In studio, we do have Dr. Geoffrey Mutuma, who is a cancer researcher at KEMRI, as well as Teresia Njeri. Teresia Njeri is an adenoid cystic carcinoma cancer survivor, and Lucy Njeri is a breast cancer survivor. Let me engage you once again, Lucy Njeri. Your diagnosis, did you go to the hospital for your just regular checkups, or did you experience any symptoms?
I didn't go to hospital for a regular checkup. I had stopped nursing a 1.5-year-old child, and I developed a lymph node under my armpit that could not go away. And when I went to hospital, I went because of that lymph node. And the doctor told me that it could be mastitis because I've just stopped nursing the 1.5-year-old child. So there was no alarm. I should have given it time and then it would clear. But I didn't just sit on it. I went to seek another opinion from another hospital. There they said that there are some fat residues that are deposited on the duct. And it's something they call fibroadenoma, and it was something that could have just been done locally and no alarm, and it could be removed. Unfortunately, when they went in, the representation of what they thought it was turned out to be different. So the surgeon took a small piece, and I was given to take for testing at Lancet, and that is now when it turned out to be ductal carcinoma. So fortunately for me, I had gone not because of any alarm, but because with women, when we stop breastfeeding, most of the time we develop lymph nodes under our armpits because we've stopped, the baby has stopped suckling, and now for the hormones to stop producing and telling the breast to produce milk, I think that's why we develop, and most likely with time they clear, but mine never cleared. And I'm also happy that I went to seek a second opinion. And because if I've just rested with mastitis, it is going to clear, probably stay at home, take no action, and also not go to have the fat residue removed. They could not have found the cancer early, so at least mine was caught, and it had not gone too far. It was the ductal carcinoma, grade 1. But then after I had my mastectomy done at KNH, and they had a bigger mass for testing, is when they said it was stage 2B. And I'm grateful that I took the step of going not to one institution, but 2 institutions, and following up on that. So I usually encourage people, don't settle for one opinion, seek a second opinion, and even a third opinion. And probably what the first person had got is probably not what the second or the third one will get. But if there's something that in common comes out, we are lucky and we get treatment. So I'm glad that I did that, and I took my treatment at KNH. That is where I had my breast removed, and I did my session of chemotherapy, and I also radiotherapy at KNH. By then, I usually say that I'm grateful because the burden was not that heavy, because NHF came handy for me. So for the mastectomy, I never paid a shilling at KNH. For chemotherapy, I never paid a shilling at KNH. For radiotherapy is when I topped up with 2,000. But the other test is that they were out of pocket. Let's say I would do the CT scan. There was chest, abdomen, and pelvics. That one costed me. There was mammography. That one costed me out of the pocket. But for the major treatment, NHF came in handy for me by then. But now it's a different story. I always say it's good to stand and talk things clear as they are. As by now, it's a different story, but we are still trying to push, and we are still trying to advocate for cancer to be covered from diagnostic to the whole treatment, and even afterward rehabilitation. Because after you've done with the active treatment, you still put on hormonal. You still go for checkup. You still go for those tests. You may be told to go for an MRI, for a PET scan, and you're still not in the active treatment. And it's still costing people, and it's costing a lot of people money, and the waiting period. I got my treatment at a government institution. I usually advocate for people to go there. The queues might be big and longer, but what I know is that the ratio of patients and the doctors nowadays is alarming. We have so many cases of cancer, and it was not as it was before, because initially we thought it was the disease of other people, the people from the other regions, older people, but surprisingly you're getting that even 14-year-old or even child or children, small children are getting cancer. And let me say that it's going to take us a while, but we are trying to do as much as we can. We are trying to create awareness. Personally, as Lucy, I said I will not keep quiet. I'll take the initiative of talking to people that cancer is here with us, and we need to look out for 1, 2, 3. And why people are presenting late is because there's no awareness. So it is us as survivors who have taken that initiative of creating awareness in our communities, in schools, in any public barazas that we get, that we speak about cancer, and we inform people that we are there. We've journeyed that journey, a journey that is very difficult. It is not easy, but we are here standing, and we don't want more people to join in. So if I go somewhere and create awareness and people go for screening and they are caught or they are told that there's something suspicious that you can see, it can be attended before it escalates to something else. Yes.
So much, Lucy. Before engage you, Dr. especially on the treatment options available, because for the case of Lucy, hers was at stage 2, but she still ended up losing her breast, right? Teresia, please just take us through your treatment journey, because you had said that you visited a private hospital, yeah? For Lucy, we are seeing that she went to a public hospital. Probably there was not much awareness on that, but how much did it cost you?
It was very expensive in a private hospital, because one, I had to buy the metal chip. Another thing, you had to pay the doctor who was going to do the surgery. Also, you had to pay the private institution.
Yeah.
And for me, the NHIF only covered the bed in the private institution.
Yeah.
Why we went through the private institution, because I had a rare type of cancer, and it was the corona period. So the government hospital, the doctors that I saw there, they kept on postponing. No theater is open. And the other doctor is saying, this is cancer, we should hurry.
Yeah.
So my guardians decided, let's go the private way, of which I'm thankful, and I'm thankful even to God and to her, because if it was not done that fast, I don't know what could have happened.
Yeah.
So it was very expensive, because I remember she took even a loan. We engaged family, we engaged friends, we did Harambee. That was the first surgery. And after the surgery now, my life changed from the Teresia that I was before to now the Teresia that I am.
Yeah.
Because eating habit was different. I was done the surgery on the face because they had to remove the left jaw. I was left with the hole inside. I was to be trained. It was painful. I had to take lots and lots of medicine. I had to keep going to the doctors often. And remember, I'm seeing a private doctor in a private hospital. So the expense became so high, because I was told to do 35 sessions of radiation in a very big hospital. So also, NHIF covered like half, no, 3/4. So the rest of the amount, which was ranging at around $500,000, it's us, the family. So for me, it was very expensive. And also the mouthwash that I'm using, the food was different from maybe feeding normally, because I was surviving on Ensure. Up to now, I had to blend food. So we had to look for food that will sustain me at that moment. So it was very painful for me. And that is the time it hit, that cancer is very painful. Self-denial. My self-esteem became so low. Suicidal thoughts, depression, you see. So, but I usually say the love that my guardian and family, friends never deserted me. That love made me heal. Yes.
And you'll tell us about your healing journey, because you now look absolutely okay and
Thank
beautiful.
You,
Daktari, as the cases of cancer in the country continually increase, we are seeing no literally, if I'm wrong, really correct me, but we are not seeing serious adjustments in terms of having enough facilities to take care of cancer patients. And I'm talking about public facilities. Do we have enough experts in the first place? We could be having enough experts, but not the enough facilities, especially the public facilities, and hence becoming a really expensive affair, because when one is diagnosed with cancer, there's desperation on the part of the family, and therefore they run where they get help as fast as they can. Yeah.
Right, you are very right.
Yeah.
You should be able to speak that with a lot of boldness.
Yeah.
Because you are very right what you are saying, and we are not seeing any activity or any right direction towards cancer in this country for a long time. I've been a doctor for quite a long time, and my background as a pathologist is that, and also as a researcher, I've seen and I've talked about it for a long time, and there's no action at all. And that's why I find that, and I've said it before, is that there's what is killing us as Kenyans. There's no attention at all on what's killing us as Kenyans. We are still thinking about TB, I think about HIV, let's think about infections, which actually most of us, we are not dying because of infections at all. Yeah. Nowadays, Kenyans, we are dying because of cancer, a bit of diabetes and hypertension. Those are the diseases which are killing us. And there's no attention paid to by the government, by the public hospitals, facilities. They are still looking and paying a lot of attention to vaccinations of typhoid, of polio, of measles. We are still there. In fact, we are thinking 30 years behind because cancer is ahead of us by far. And that's why I think Teresa have said it, and actually Lucy also talked about it. We need to pay a lot of attention to cancers. And me as a person, I've seen a lot about cancer, and being my profession, that I said that I did a lot of research in Kemri. I left Kemri and I started my own hospital dealing with cancer mainly, and of course I'm back in Kemri now. When I look at the difference which is happening, we are back by far, and that's why we need to catch up with where the cancer is now. I've said that what we need and the action we need to take now as individuals, as a community, and also as a country, is to know cancer is there, and cancer is there, and cancer is very common. Because I know, and of course, even from my village where I come from, is that I've seen so many people pass on because of cancer. People I know, people I've grown up with, they passed on because of cancer, and they came to me when it's too late. And even some of them, they did not even seek for any medical attention at all because of the cost. And that's why the cost of cancer treatment is very high. And that's why if we need to save lives in Kenya, and we say that prevention is better than cure, and prevention is normally very cheap. When we go to issues of cancer control, cancer prevention, that's why we should be able to emphasize on at this time. And this is something which we need to take it very seriously on cancer control and cancer prevention. I was fortunate that I was trained on cancer prevention and cancer control back in 2000 in US, in National Cancer Institute. And I think when I was trained and I came back to Kenya, 2000, I started those issues which we can focus mainly on cancer control and cancer prevention, not treatment, prevention and control, because that's what's very important. And of course, surveillance, following how the cancers are rising, which cancer are becoming common, and which cancer be able to reduce. Now, in cancer treatment, and I think both survivors of cancer have talked about it, is that the first thing is that in cancer, treatment is a long journey, very expensive. And once you are diagnosed, you have got cancer, and I talk this from my perspective of my hospital, that's from Zambezi Hospital, where I see cancer patients. And I normally see cancer patients almost every day. And I've got that experience when what patients go on in public hospitals and what patients go on private hospitals. And Zambezi Hospital is a private hospital, and I've got a lot of experience. I've run this hospital for almost 10 years now. Two things, very important, is that patient has to know he has got cancer and he has to accept it. That's the first thing. Second thing, the patient has to accept to be treated. Know you've got cancer, accept to be treated. I know there are so many patients who come to them, when they come to me, They told me, Daktari, I've got cancer, but I'm not willing to be treated. And remember, when a patient says like that, you cannot do anything. You just leave that patient, and in most cases, we just advise them what to do. Now, in cancer treatment, and this is very important, is that there are 5 steps of cancer treatment, which we seem to overlook the first 3. The first one is that when patient has got cancer, the first treatment is counseling. Because most of the patients, they've got cancer and they go very fast to treatment, they need to be counseled. In most cases, especially, this is my own opinion and my own approach, is that when a patient has got cancer, I don't even tell that patient has got cancer until he has got somebody else, either a relative or somebody else who he trusts, or a guardian. Because cancer is not a disease you tell somebody like that, you've got cancer. And I know most of us doctors, we do like that. So the first thing about cancer treatment is counseling. The second thing very important about cancer is food. Food. Because you need to change your diet. Once you know you've got cancer, you need to change your diet, because there are some diets which we take every day, they encourage cancer to grow. So you have to change your diet. The third thing, which is very important and people ignore, and I know my fellow doctors even ignore it, is to get fortified foods. Fortified foods are called supplements. Something which you can take and is a fortified food, like you can get carrots, you can take fish, you can take, is fortified, very important. And most of the patients, when they go to the fortified food, the supplements, they do so well. They do so well because cancer, it has brought you down, your immunity is very low, and you've got other complications. When you go to diet, fortified foods, before the treatment, that it means a lot to the patient. First thing, counseling, diet, supplements. 2-3 things are very important for a patient with cancer. Now, treatment. Now, treatment is a whole complex, because most of the treatment, the cost of treatment of cancer,
as wind up, Dr.
Yeah. Most of the cancers, the treatment is almost $500,000. Most cancers, that's the average. And before you reach there, it means a lot for the patient. Before you reach the treatment, that's a lot for the patient. Thank you.
All right, thank you so much. As we wrap it up, I want to welcome Lucy Njeri. Lucy, I know you've been cancer-free for some time now. Maybe you can tell us how long. Probably this will bring hope to patients out there who are reluctant to getting into the treatment journey, because most people feel that once you have cancer, then you cannot get help, you cannot get cured. Tell us more, Lucy.
My diagnosis was in 2017, and now we are in 2023. So survivorship starts the moment you are diagnosed. So this is my 7th year. There is a lot of hope, and there are so many challenges. But I'm very grateful. By the time I was getting my treatment at KNH, people all the way from Nakuru used to come to KNH, Mombasa, KNH, and Garissa. But calling a spade, we have cancer centers that have been opened in Mombasa. We have a cancer center in Nakuru, and even Garissa the other day. So at least I know the burden of people traveling all the way to come and get treatment in Nairobi has been a little bit eased, so people can get treatment from wherever they are. If you're in Machakos, I know there's a cancer center there. And why do you go to the public or to the government institution? It's because of the cost. By then, consultation was 650, and if I could have gone to a private institution, it was going to go for 4,500, so it was on the higher side. So preferably, and what I usually tell people is that in the government institution, and probably most of the national institutions, the NHIF card covers the bulk of the treatment. And also, it might take long. You might queue, but once you're in the system, you are good to go. After the diagnosis, I am here, and I'm living life fully, but back in me, I know that I don't have a breast, so I'm categorized as a disabled person. I know that mentally there are issues because you had your body was okay. Now you've become a disabled person in a way that now you're a big person, you're mature, you don't have your hand, you don't have your leg, part of your breast is gone, your uterus has gone, and these things people will never see them. You can't, when you look at me, you can't tell that they have gone, but that needs to be looked up, and that's why I always talk about mental health. We are losing people not because of cancer, but because of depression. People don't know where to run to who to talk to, who to open to, and do we have the safe spaces? We don't have those safe spaces such that when I go and share what I'm feeling or my emotions, that I'll be looked upon. The other day I raised an issue with the oncologist. We've been looking at cancer physically, okay, treatment, and it is okay, but emotionally, no. Something else that we've not been looking at is sex, reproduction health, and family. After you got a cancer diagnosis and you've gone through the treatment, your body changes, especially for reproductive health. Our body changes. You are married, your husband demands for a kid, you've been put on menopause, you can't conceive. Okay, you are married, your husband has prostate, you want a kid, he can't sire a kid with you. Where are we fighting? Where are we? We are in a hazy somewhere because these things are not looked at. And it's time that we spoke loudly about them so that people can come in, so that when there's a plan for you, they are going to put you into the right plan, and even afterwards.
Thank you so much, Lucy. Thank you so much, Lucy. Indeed, time is not on our side, but we shall have this conversation once again on the kind of help that survivors and patients can really get. In 30 seconds, please, your parting shot. In 30 seconds.
Thank you so much. What I'll say, like, cancer patients should join also some organization. As for me, healing process started at Lady Hope Wellness Institute. Veronica Mwangi came through for me. And also your mindset. And I usually say, I'm not here to impress, but I'm here to inspire. I use a gadget also. And being inspired by someone else made me the way I am. So my guardian, may her soul rest in peace. Veronica took over. So, and everything is good, and I pray so hard. I'm a believer, and I believe working hard with a terminal illness makes you survive.
Thank you so much.